Attorney Jonathan Elson, reminding you that if you've been injured in an auto accident, it's important to have somebody on your side. When you need a lawyer,
then you need Nelson.
Governor Joe Lombardo announced a new initiative aimed at transforming healthcare across Nevada, particularly in rural and undeserving communities. Today on May 15th, Governor Lombardo visited the Kirk Kerkorian School of Medicine at the University of Nevada, Las Vegas to discuss this new act.
And just to give you a little background and color on how my administration has conducted our business, as you know, we have more than one comprehensive bill going through the legislature. And they're very large bills because it affects a very large swath of the population in the entire state. And it would be malpractice can I use that word in here? Malpractice. It would be malpractice for me to try to author or write legislation that didn't include all our subject matter experts and the people that are the benefactors of legislation. We bring people that are the experts in the field from the community prior to the legislative session, not just people internally to state government. And the reason behind that is we don't have all the answers, right? And we don't know all the unintended consequences, all the hidden threats associated with bad legislation. And we did the same today for the Health Care Act. And it's important for people to know it's not done in a bubble, and it's not done strictly in my mind, because if that was to happen, it would be poor legislation. But it's my goal to push it forward as the leader of the state.
The newly introduced Nevada Healthcare Access Act is a comprehensive reform package that tackles provider shortages, red tape, and inefficiencies in the state's healthcare system. While at the school, UNLV's interim president, Chris Heavey, also stopped by to speak as well.
At UNLV, we know that we exist to improve the well-being of this community. And one of the things that we understand, after 80 years of explosive growth in the Las Vegas community, we have always struggled to keep up with the number of healthcare providers that are needed for Southern Nevada. And so we're so happy to have now this new School of Medicine here. And what we know is we need partnership with others to be able to not just train the residents here, but as the dean said, have them train the undergraduate students here in undergraduate medical education, but to have them continue their residencies here. And we're so happy that the governor recognizes this urgent need, because what we know is that students who do their residency and their undergraduate medical education here stay in Southern Nevada. 80% of them will end up practicing here. And that's what we need, is more doctors for this community.
The legislation also aims to improve mental health care access by establishing a new Office of Mental Health here in Nevada. Finally, the act modernizes the state's Medicaid system by integrating electronic health records, expanding eligibility for vulnerable groups such as foster youth, and eliminating barriers in healthcare.